Okay, I thought it was about time I did an update on my health with regard to MEN1. Today, of filming this is the 19th of April, and in 2 days' time, it will be a year to the day that I first went to the doctor for a referral for the gene test. Where we are now, I know a certain extent of what's going on. I don't know everything, okay, but I thought I'd give you an interim update. A couple of new things have happened since my MRI. I've had a CT PET scan and, what I was really dreading, an endoscopic ultrasound. Just about a couple of weeks after my last vlog, I had to go back to Guy's and I had a PET scan. This was in the cancer centre at Guy's Hospital, so it's just a little round the corner from where the main place is. It's very, very modern, really nice place, very open, very quiet, and I went through the usual spiel of going to the reception, handing in my letter, go take a seat, and I thought that they would do the normal thing, like they take you aside, check your details, you go back to your seat, and then wait until they're ready to perform the procedure. When they called me over, I just got up and walked away. So I left all my stuff there with my wife, but they were like, "No, come through." Oh, okay, well, I didn't actually know they were going to do that, so I had to apologise to my wife later. Sorry, I just had to leave you with everything. They took me to a room where they weighed me, took my height, took my blood pressure, put the cannula in my arm, did some questioning. They weren't 100% sure why I needed the test, but to be honest, I don't really need to know. They just need to perform the procedure. And I had to remove everything metal, so I just put on my tracky bottoms and everything. And they said, okay, well, when we put the cannula into your arm, we'll take you into a room, which was nice. It was like a private suite. But the chair I was on was like a bed slash chair, and it wasn't very comfortable. They said, right, when we've put the sugar water into your system, you're going to be radioactive, so we can't be near you for about an hour. So I was in that room for an hour, bored out of my brains. I had nothing to entertain myself with. I couldn't even use my phone. They said, you have to relax. You have to sit back and relax. And I did. And I just sat there, just not doing much. There was a woman in the booth opposite me. I didn't say hello to her or anything, but when she was ready for her scan, they buzzed her in through the intercom. Every one of those booths, even though they had just a curtain for a door, had an intercom and said, we're ready for you now, please can you go empty your bladder. And even though it was in the booth opposite me, it made me jump. I thought, where the hell is that voice coming from? And then I realised there was one in mine. It literally just looked like a ventilation shaft, but it wasn't. It was an intercom. So I was waiting for that to happen to me, but they didn't. The nurse actually came in herself and said, Erin, can you go and empty your bladder and then follow me to the room? So I had to leave some of my stuff away from the machine, and like the MRI, it's like a donut and a kind of a gurney thing, like conveyor belt that you move up and down on, and I didn't bash my knee this time. I just lay on it, and when they give you an MRI, they strap you in and they put all these things on you, and it's really just mad. But with the PET scan, I just had to lay there with my arms above my head. They put a blanket over me, and the test was completely silent. No sound whatsoever, but they didn't give me headphones to listen to music at least, because otherwise it's just boring. I didn't fall asleep or anything all the time I was in there. I was just sort of counting, I suppose. And when it came to getting out, because I had my arms above my head for 45 minutes, or it felt like 45 minutes, when I tried to put my arms down, my shoulder went into spasm. It was really painful. Oh, it took a while for that to recover. Then I just had to get dressed and then go. That was it. Nothing further. But then I contacted Guys about a week later and said, look, I know I only had my PET scan a week ago, but I had my MRI several weeks ago. I still don't know what the results are, and they said, well, we're still looking at things. We have got some of the results of the MRI, but not the PET scan. So we want to look at everything. But we'll send you an email with some of what we found from the MRI. So I've got the preliminary results of my MRI right here. It's a bit faint. It's on a PDF. It says, it says she has no galactorrhea. I don't know what that means. This says about my periods have always been irregular. They've become erratic recently. No body aches, no pain, no diarrhea or reflux symptoms. On examination, there are no features to suggest acromegaly, which is like enlarging of the hands and the feet due to increased hormones, or Cushing's. She has no bruises. My blood pressure was sky high when I had my first consultation. My heart rate was high. Chest is clear, abdomen soft and tender, heart sounds normal. No proximal myopathy. Don't know what that means either. No significant past medical history. At the time of having my initial assessment, I wasn't on medication. I'm now on sertraline, which is just for anxiety. Then it says about my bloods, which I've already been assured were normal. Okay, so on the 15th of January when I had my MRI, it said no previous cross-section imaging for comparison. Whole body remains contrast imaging and diffusion weighted imaging through the thoracic, abdomen and pelvis acquired. Conclusion. Now this is what concerned me. 9mm presumed exophytic, which means on the outside. Pancreatic net, which means neuroendocrine tumour, anterior and superior to the pancreatic tail. Then I think some things are there like coordinates as well. There might be further smaller peripancreatic P-nets. That's what they call them, P-nets, pancreatic neuroendocrine tumours. Sounds a bit silly, I just call them nets for short. EUS, which means endoscopic ultrasound follow-up, would be helpful. Possible small gallbladder polyp. And it says adrenal is, there is a likely P-net with possible peripancreatic lymph adenopathy. Again, I'm not 100% sure what all of that means. A few weeks after that, I then went for the endoscopic ultrasound. Now, this is a procedure which is not straightforward. If you are in the UK and you ever need to go to what they call Guy's and St Thomas's, pay attention to what is noted on your letters and your text messages, because Guy's and St Thomas's are not in the same location. Guy's is just outside London Bridge Station, and St Thomas's is just round the corner from Waterloo Station. They are about 3 miles apart. There are shuttle buses that go between them for patients. Yeah, when I received my letter for the endoscopic ultrasound, it didn't look any different to normal, and stupid me, I didn't pay attention to the fact that it said St Thomas's, and I didn't think that Guy's and St Thomas's were that far apart, because they are called Guy's and St Thomas's. So you think that it's just one big hospital or 2 hospitals right side by side, but they're not. They're 2 completely different hospitals. So we went to London Bridge, got there, and they said, oh, I need to go to, I can't remember what wing it was. I said, that's at St Thomas's. And I said, well, how long will that take to walk? And she went, walk? It's about 3 miles away. And I was only 5 minutes away from my appointment time, or something very close, like 5 or 10 minutes. And I was like, oh my God. And they said, right, okay, walk around here. I'll phone them, let you know you're going to be a bit late. Walk around here and wait for the shuttle bus. Eventually we got there okay, and we got to the right part okay. And thankfully, I was okay to have the procedure. The endoscopic ultrasound requires you not to eat anything for 6 hours before the appointment and not drink anything for at least 4 hours. They want your stomach to be completely empty. When we got there, I filled in the usual questionnaire. I was then called in. and I went through certain things with one of the radiographers, and usually with the cannula they can usually get my blood okay. I mean, I'm not scared of needles, so I just went, yeah, go for it. So just tried to put a hole in this arm to get the cannula in, didn't work. Tried to do it in this arm, didn't work. And then they had to get the doctor to actually finally get the cannula successfully inserted into this arm again, and I ended up with a bit of a bruise on my elbows, but it was fine. I was then moved into another room, and I spoke to a lady who told me all about the risks, and the risks are perforation, infection, which is pancreatitis, so they said they can get you antibiotics for that, but you have to be very vigilant with that kind of thing. Vomiting as well as a risk, potential reaction to the sedatives. Interesting, because I've never had sedatives before, so I wouldn't know how I'd be. I was then taken into another room which looked like a theatre slash forensic lab, and there were 3 people, no, was it 4? 3 or 4 people in there. And I was told first of all to lie on my back. They went through some of the information with me, and they explained that they would numb my throat and then put a mouth guard in my mouth. So the throat spray was sort of very, very sort of had like a warming sensation. If you've ever been to the dentist and you've had the numbing stuff on the teeth, and it had a banana flavour, but it wasn't a very nice banana flavour. It was almost citrus banana, if that makes sense. And a couple of sprays, and then of course my mouth and my throat went numb. And it was like, ugh, not very nice. They then said, lie on your side. So I did. And I had to make sure I was well adjusted and I was comfortable. They put the mouth guard in my mouth. I had to move my arms slightly because of the cannula. And then they didn't tell me they were putting the sedatives in. I could just sort of feel them twiddling with it. And then, it was honestly, it was like falling asleep fast-tracked. It was really, really quick. I do not remember them putting the camera down my throat. I don't remember most of it. I sort of started to come to when they were standing around the sort of screen and saying, oh, what about this, what about that? And I remember thinking, I've got to listen to what they're saying, I've got to remember this. And I listened to what they were saying, but I cannot remember what they were saying. One thing I do remember them saying was, biopsy that. So, and then I felt kind of, oh, what's going on down there, in my stomach. It wasn't painful or anything, it was just uncomfortable. After a minute or two, I started to gag, and I gagged, and I gagged, and I gagged, and that was when they were taking the camera out. And when that was done, they took the mouth guard out, and they said, right, we're all done. And I remained on my side for a little while. They wheeled me back to the place that I was in before when they were telling me about the risks, and at that point I was allowed to lie on my back, and they monitored my blood pressure and pulse for the next half an hour. I was told before the procedure, and I was told in the information they sent me, that I'd get a cup of tea and a biscuit, but I didn't. When I eventually was reunited with the wife, we went into a room where they gave me a printout of what they did, and what they found was the 9mm tumour that they found on the MRI was actually 8.2, so it's not as big as previously thought. And then they found 2 other smaller pancreatic tumours, but they're all clustered around the tail of the pancreas, so it's where the stomach is on the left. They took biopsies from them, They found my stomach was normal, my esophagus was normal, liver appears normal, but they have limited information on that. Everything else looked normal. And when the procedure for the endoscopic ultrasound finished and I got my coat on, we're ready to go. It was late at night. We had to get went to Waterloo and then back home. On the train, it was dead. There's hardly anyone on it. And I had a little bit of something to eat and drink, not too much, because you're supposed to take it easy because the stomach's sensitive and everything. And on the train, I actually started to get a sweat. I was shaking, my heart rate was going funny, and then I had to run to the bathroom and was sick. I was worried that it might be blood. They did say to me, if you vomit blood, you've got to come back. Or if you end up in a huge amount of pain, you need to come back. So I had that, and I just carried on drinking water. And when we got back home, I had a cup of tea, and it was near enough 10 o'clock at night, and I had work the next day. And the kind of job I do, I don't operate heavy machinery or anything like that. So I went to sleep, I woke up at the normal time, got to work, but I just could not concentrate. These sedatives take a while to get out of your system, and if you've never had it before, you don't know how you're going to react to them, do you? And I ended up going home, and I went to sleep that night at about 7:30. And then the next day I went to work okay, but then that day after, because the wife, of course, she's going through this journey with me, we were both knackered, so the following night we decided that we would just get something to eat and just get in our jammies, get into bed and just watch telly, cuddled with the cats, go on our mobiles and everything. We just had a nice quiet evening, and I think we both end up going to sleep at about 8 o'clock at night. So for 3 days we were both shattered. And when I slept, because my stomach was sensitive and the cats sometimes like to jump on me, I had to lie on my back each time because lying on my side was uncomfortable. I had to put a laptop tray over the top of me. If the cats wanted to jump on me, they'd jump on that as opposed to me. So, and that really did work. I had to, well, I didn't have to, but I felt the need to use that for at least 5 nights. It took a few days for my stomach to start to feel normal again and be able to eat normally again, because it's not that it's painful, it's just that you can actually feel it's sensitive. It's saying, you kind of mess with me and I don't like it. And I also found out from a friend I met online that the pancreas does not like being poked. It doesn't. It hates it. It can react to that. Luckily, I wasn't in any pain. There were no complications. That was several weeks ago, and I'm fine. When I get the results in about a month's time, I will let you know ASAP what the position is. And you know, this is going to sound strange, but the whole thing about being gay, having autism, and this gene has set me apart from the norm. You know, the vast majority of people are straight. The vast majority of people don't have autism. The vast majority of people don't have MEN1. And I was thinking to myself today, do you know what? Embrace the weirdness, embrace the difference, and therefore I'm just going to get on with it. But then again, when I get the news as to whatever it is, if it's bad news, how do I know how I'm going to react? I don't suppose you know until you're in that situation. But I'm looking forward to knowing exactly where I stand. It's been a year since I went to the doctor, and I only semi-know what's going on. I know I have the gene, I know I have pancreatic tumours, I've had several tests, I know my blood tests are normal, I've had several tests, and it's been okay, you know, it's not been a traumatic experience at all. Anyway, I'll stop waffling. And thank you very, very much for watching today. And just a little bit at the end, I'm currently experimenting with different editing styles for my gameplay. There's 2 videos on the channel that I've done recently. One I did in a kind of a silent film style, the other one was just plain funny or it's supposed to be funny, and I'm trying to make gaming videos a little bit more entertaining by doing some fancy editing, but without taking away too much from the gameplay. So go and watch those, please. I'd really appreciate it. Thank you very much. Bye, everybody. Bye bye.